not very sort of comforting for a social scientist trying to work in the field of AMR. It's very, very minuscule what has been produced of social scientists with regards to the AMR threat. And it's sort of a bigger problem because AMR is so obviously a problem that needs social science inputs, both on the global level and the meso level and the local level, right? So that was sort of a big surprise for me that you simply didn't find a lot of social science research. And the research that had been published was mainly published by medical professionals. And so what I'm arguing is that we need to have more social sciences that influence not only medical anthropology, although that's very important, but also that illuminate some of the other more gray areas, specifically at the global level and national level. So in my review, the challenge is not so much popularizing scientific knowledge, but to mobilize and to build networks and so on. So what is it we need to set the agenda? It's not just awareness, it's trying to build coalitions outside the medical community, because right now the medical community is driving the agenda forward and also sort of defining the agenda, framing AMR as a health issue. But I think in order to really get our footing in the sort of global political agenda, we need to sort of begin to build bridges to other, you can say the public, to other NGOs, to lobbyists that are much more flexible and much more knowledgeable about how to actually put issues on the political agenda, because that's not the forte of health expert, I would argue.
One thing that I would say that from our analysis, it promotes this question of, are we wanting to protect people or to protect medicines? And we started out with the rational medicines, rational drug use programs, wanting to rationalize drug use in line with making it cost effective and making it safe. With antimicrobial resistance added on top, a warning I would put out is that, let's be careful not to shift our entire kind of effort towards just saving the medicines. The reason we're saving medicines is still for the same end, which is to protect people and to provide the best quality care. There's an increasing amount of social research that is pointing to the fact that the reason that we're using antibiotics isn't just because of somebody trying to make a decision and having all of these influences around them, but actually that there's much wider, more infrastructural reasons that we end up using antibiotics. Antibiotics end up propping up our systems. And while we've still got such poor hygiene and really, inadequate health infrastructure in many places, and we've not got the capacity to do really good patient care, antibiotics at the moment are propping that up. We need to be really aware of that before we push messages to just stop using them. We also follow the science and the policy object of AMR. So we can see that antimicrobial resistance has successfully, I would say, become stabilized as a political object, which you can see in part because it was made into an economic issue. And also because it was made into a global security issue, in addition to the health issue that we knew it was before. Doing social analysis of the ways that policy is formed is incredibly important. It helps us to realise how we are gaining traction with certain issues like AMR, but by labelling it an economic and a security issue, it focuses our minds on particular things that will address the security angle, for example, of antimicrobial resistance, which may cause us to focus more on spread and may cause us more to do certain things like extract information from some places to put on a global platform so that we can check whether AMR is moving around the world. That's quite different to addressing it as a health issue. So we do need to be really careful about the ways that we are framing the problem in terms of the kinds of things that we end up thinking of as being the solution.